Good morning, and thank you for joining us for today's convening on non-fatal overdose response. My name is Matt Eisenberg, and I'm the director of the Center for Mental Health and Addiction Policy. For 10 years, the center's work has been about helping people with mental health and substance use disorders through policy research. This series is one way in which we share our work with you and spark discussions that matter. I want to express our thanks to the Provost's Office, the university's Nexus Award Initiative, and the Bloomberg American Health Initiative for their generous support of our center in this series. Thank you to the Center's Director of Research, Aline Kennedy Hendricks, Director of Policy, Brendan Saloner, Director of Training, Sachini Bandera, for organizing today's convening. And thank you, of course, to the Hopkins Bloomberg Center team, Sam Rosenberg, and the HPM Comms team for all their work. I now have the great pleasure to introduce Mayor Muriel Bowser, the 7th elected three-term mayor of Washington, D.C., who has served the city since 2004. She's led major efforts on substance use disorder, economic development, and public safety while guiding D.C. through significant public health challenges. We're fortunate to have her here today to speak on non-fatal overdose response and the importance of supporting community well-being. Thank you, and please join me in welcoming Mayor Bowser. Thank you so much.
Good morning, everyone. I'm so happy to be here, and I want to thank Matt for that lovely introduction. And I want to welcome you to Washington. It is great always to be here in the heart of our downtown, and great to be at the Johns Hopkins Bloomberg Center. As I was outside, I was just remarking on how beautiful this building is and what a great addition it is to have thought leaders come to this building to explore all manner of issues, and this is especially an important one to us. I want to acknowledge my team in DC government who are here, especially Dr. Barbara Bazron, who leads our Department of Behavioral Health. Give her a hand. There she is. And I know another DBH team member is going to represent us on this panel. Also, Kiana Creighton, who works as the Chief of Staff for our Deputy Mayor for Health and Human Services. And I think is a Johns Hopkins alum. So, Kiana, thank you for your leadership. So I have had the privilege of being mayor of my hometown since 2015. And since then, we have been very focused on how we build a strong, responsive system of care for residents who are struggling with substance use and behavioral health challenges. We know that we need a system that is grounded in best practice, informed by data, and importantly, a system that is tailored to the lived experiences of Washingtonians. We know, for example, that the opioid epidemic in D.C. is disproportionately affecting Black residents and men in particular. And that's not necessarily what we see in other parts of America, including kind of the average age of people impacted. We also know that one of the strongest indicators, and I know you're talking about that in today's conference, of the strongest indicator of a fatal overdose is a previous overdose. And that's why we work, the work that you're doing is so critical to our learning and to our practice. And it's why we have also saturated our city with naloxone and in just about every way it could be dispensed, we have considered or are doing. In 2024, we distributed more than 100,000 naloxone kits. It's available at no cost and no ID, and no prescription is required. And last year, for the first time since fentanyl infiltrated the market, and we're very proud of this, and we know there's more to do, but we know it represents lives saved. We saw more than a 26% reduction in opioid fatalities in Washington, D.C., and a 13% reduction in non-fatal overdoses. So we know that consistent and persistent efforts are working here. Part of how we've been able to reach people in a more targeted and strategic way is through our new DC Stabilization Center. We opened the center in 2023. It is a 24/7 facility designed to provide immediate, compassionate care for those experiencing acute intoxication from drugs or alcohol. The center also offers behavioral health support, peer counseling, and connections to long-term treatment. And the team at the Stabilization Center is saving lives. We, through the DBH research and data, determined the best location. It was one of our existing facilities that was built out in a way that was comforting to those, low barrier, walk in, get help, get stabilized, and hopefully connect to treatment. And since its launch, the center has had more than 8,200 admissions, serving 2,600 unique individuals, many of whom have returned multiple times. Dr. Bazran just told me that one individual came 50 times, and on the 50th time, he connected to care, which highlights the need for sustained intervention. The data correlates with what I just told you about the uniqueness of DC's problem. 83% of those admitted to the center are Black residents, 85% are male, and the majority are between the ages of 40 and 49. When they come to the center, they are able to build relationships with staff, and it's our hope and our goal that over time, more patients will open up to the idea of long-term recovery. The Stabilization Center is also helping our emergency rooms and so that they can be available for other health emergencies. And with the center, we've been able to divert more than 3,400 people who would have otherwise ended up in the emergency room. Instead, they're getting the care that they need and getting stabilized. We're also expanding these efforts by opening a second stabilization center in Columbia Heights, where we know that there's a concentrated need for additional services. There are also efforts that we are exploring at our DC Fire and EMS so that we can, when encountering people on the street, get them to care. So we are committed to saving lives in our city, and we're committed to learning more about how to do it better. So thank you for having us.